Today, we're diving into a crucial topic: water, sanitation, and hygiene, widely known as WSH. WSH is truly a cornerstone, forming the very foundation for global health and sustainable development worldwide. Let's begin by gaining a deeper understanding of what exactly WSH encompasses and its vital components. These elements are often referred to as the fundamental pillars that uphold public health in communities everywhere. First, we have water access, which is about ensuring everyone has reliable access to this essential resource. This means guaranteeing that clean and safe drinking water is readily available for every individual, without exception. Next, we focus on sanitation systems, crucial for managing waste safely and effectively. This involves setting up proper systems for the safe disposal of human waste and treating wastewater responsibly. And finally, we have hygiene practices, which are essential for preventing the spread of illnesses. This includes encouraging vital behaviors, such as consistent hand washing, to actively prevent various diseases. Now, let's explore the significant health benefits that arise from having clean and effective WSH facilities. These benefits are profound, directly preventing diseases and significantly improving the overall quality of life for many. One of the primary benefits is that proper WSH actively prevents a wide array of dangerous diseases. It significantly reduces waterborne illnesses such as cholera, typhoid, and common diarrheal diseases, protecting public health. Another critical benefit is the direct reduction in child mortality rates globally. This lowers deaths, especially among children, caused by diarrheal diseases and associated malnutrition, saving young lives. WSH also plays a crucial role in effectively controlling and limiting various infections. It decreases the prevalence of parasitic, skin, and eye infections, improving community health and well-being. Furthermore, robust WSH systems are vital in supporting better maternal health outcomes. This ensures safer childbirth experiences and significantly reduces neonatal infections, particularly in healthcare settings, saving lives. Conversely, it's essential to understand the severe consequences of inadequate WSH provisions. Poor WSH poses substantial risks, directly threatening both individual health and overall community well-being. Let's look at the core issues that contribute to these adverse effects. A major problem is contaminated drinking water, a direct pathway for many illnesses to spread. The absence of proper toilets leads to open defecation, creating significant public health hazards. And of course, poor hygiene practices exacerbate the spread of infections and diseases. Now, let's examine the specific health impacts associated with these core issues. Contaminated water dramatically increases the risk of severe diseases like diarrhea, cholera, and typhoid. A lack of toilets directly spreads diseases by contaminating precious water sources and the environment. Poor hygiene significantly raises the risk of respiratory and various skin infections within communities. To illustrate, let's consider some real-world examples of these devastating consequences. A tragic example is the 2010 Haiti cholera outbreak, directly linked to inadequate sanitation systems. Think about India's situation before the Swachh Bharat mission, with widespread open defecation causing health crises. Globally, we see a disturbing increase in child infections due to consistently poor hygiene practices. Let's now explore some of the major global initiatives that are working to improve water, sanitation, and hygiene worldwide. These initiatives demonstrate collaborative action, bringing together various organizations for a healthier world and better living conditions. First, the UN Sustainable Development Goals, specifically Goal 6, aim to ensure availability and sustainable management of water and sanitation for all. The WHO and UNICEF Joint Monitoring Program, or JMP, tracks progress on WSH targets globally, providing crucial data and analysis. The World Bank's Water and Sanitation Program, WSP, supports countries in providing safe, affordable, and sustainable WSH services. UN Water coordinates the efforts of various UN entities and international organizations on critical water and sanitation issues. The Global Sanitation Fund provides financial support and expertise to help countries achieve universal access to sanitation services. Now, let's turn our attention to India's impactful Swachh Bharat mission, a significant national effort for sanitation. This mission is truly a national movement, mobilizing communities across India to improve sanitation and hygiene practices. The Swachh Bharat mission was officially launched in 2014, marking the beginning of a transformative journey for sanitation in India. Phase 1, from 2014 to 2019, focused intensely on eliminating open defecation and constructing household toilets across the nation. A primary goal of SBM was to declare India open defecation-free, significantly improving public health and dignity. This phase saw a massive drive for toilet construction, providing millions of households with access to safe sanitation facilities. Phase 2, which began in 2020 and continues today, builds on the successes of Phase 1, focusing on sustaining gains. In Phase 2, the mission expanded its scope to include comprehensive solid and liquid waste management across rural and urban areas. Let's delve into the distinct WSH challenges faced in both urban and rural areas, as they require different solutions. Understanding these differences is crucial for developing tailored solutions that effectively address the unique needs of each setting. In urban areas, specific challenges arise due to high population density and rapid development. Overcrowding in cities often places immense strain on existing sanitation infrastructure, leading to inadequate services. Poor solid waste management is a significant issue, contributing to pollution and health hazards in densely populated urban environments. Contamination of water pipelines by sewage leaks poses a serious threat to public health in many urban settings. Furthermore, inadequate maintenance and limited access to public toilets remain persistent challenges in urban areas. Now, let's shift our focus to the unique WSH challenges prevalent in rural areas, which often differ significantly. Open defecation is a major concern in rural areas, primarily due to the severe lack of proper household and community toilets. Rural communities often face limited access to safe water infrastructure and a consistent, reliable supply of potable water. Poor waste disposal systems lead to accumulation of garbage, impacting environmental health and community well-being in rural settings. Menstrual hygiene management remains a significant issue for women and girls in rural areas, often due to lack of facilities and awareness. Let's now explore effective strategies for achieving sustainable water management. Ensuring this vital resource for future generations, we must implement water conservation techniques, such as rainwater harvesting and efficient irrigation systems, to reduce overall water consumption. Protecting our water sources is crucial, achieved by regulating industrial waste disposal and promoting the use of eco-friendly fertilizers. Investing in advanced wastewater treatment and recycling systems allows us to safely reuse water for multiple purposes, conserving fresh supplies. Promoting water equity means ensuring access for everyone through robust infrastructure development and community-led management initiatives. Finally, adapting to climate change impacts requires conserving water during droughts and implementing strategies to effectively manage flood risks. Let's now summarize our discussion and recap the most important points we've covered today. Here are the key takeaways regarding water, sanitation, and hygiene, or WSH, that you should remember. Remember, clean water, proper sanitation, and good hygiene are absolutely fundamental for public health and overall development. Conversely, poor WSH conditions unfortunately lead to widespread waterborne diseases and tragically increase child mortality rates globally. Sustainable water management is crucial as it protects our vital water resources for both present and future generations. Global initiatives and national programs, such as Swachh Bharat Abhiyan, significantly drive improvements in sanitation practices. Both urban and rural areas face distinct WSH challenges, meaning we need specific, tailored solutions for each. Finally, collective action from governments, communities, and individuals is absolutely vital for achieving a healthier world.